Hello and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And today we have a very special podcast, not just because we have an amazing guest, but we have an amazing guest in the studio with me today, which I'm super excited about. And our guest is Jennifer Fernjack. She wrote a great book called Greater Than, which is the power of strength and emotional grit. Jennifer lectures internationally about anxiety and how to use your environment and your community, how to basically de-stress the environment that you're in, and how to have emotional grit. She talks a lot about emotional grit, which is really an interesting topic and frankly needed in dentistry. So Jennifer, thank you so much for being on the podcast
Thanks for
today.
having me.
Well, I want to start off with, how did you even come to the point where you wrote this book? Because this is a very interesting topic, but it doesn't. I haven't read many books on emotional grit. So how did you come to do that?
Well, good question. So in 2016, I got the surprising diagnosis of a meningioma brain tumor. And I say surprising because I never had any headaches, no motor skill problems, no speech impediments. I literally went in for an eye appointment where my eye doctor said, for the second year in a row, you didn't do as well on your peripheral vision exam. And she literally acted on a hunch, sent me to an eye specialist. He did more tests and took pictures of the backs of my eyes. And he also acted on a hunch and said, I think something's pushing on your optic nerve. He then had me have an MRI, and the MRI is what actually revealed the tumor. And so through my whole experience, I thought, well, why is it that things such as gratitude, music, pets, laughter, acts of kindness, different things like that, I thought, how is it that they're all taking the edge off my experience? Well, I did some research and learned they can lower stress hormones and actually increase the feel-good chemicals of the brain, such as dopamine, serotonin, or endorphins. And so I thought, has my experience been kind of unique? So as I traveled for work, I would interview people that I would meet. So people on planes, people at hotels, offices, whatever, local people in the Twin Cities as well, and learn about their stories of emotional grit. Pretty powerful stuff.
Well, you just went through a lot of stuff in a short period of time. I'm
Yeah,
like, so first of all, you just go to the eye doctor and find out you have it. I mean, let me ask you it this way: is your experiencing healthcare providers today very different than before that day?
Yes. And I would say part of that difference is on me in that I have an enhanced appreciation for what caregivers do.
Hmm.
So whether it's my surgeon or the doctors or my eye doctors or dentists, I have an appreciation for not just what the patient experiences, but also you as the caregiver, because there's certain stress that comes along with those jobs. So now when I go into the hospital to have my annual MRI done to make sure that like what's the latest going on with my head as far as
Mhm.
6 years later after the surgery and radiation treatments, I actually write out a thank you note every time to the nurse practitioner who's going to actually read the results to me of the MRI. Because I thought, imagine having a job where you're possibly giving people bad news all day. That doesn't just affect the patient, that's also going to be hard on the person who's giving the news. So by making it about her and actually expressing gratitude through the card, it takes a focus off of me and makes me feel better. And I'm not in denial about my experience. I just want to have a better attitude towards it. So,
Yeah, I mean, well, it's interesting because sort of with the whole focus of this podcast and the book that I wrote this podcast is based on is having health professionals look at healthcare and dentistry through the eyes of the patient. And you're kind of
yes,
doing it the opposite way
right.
around, which is
Yeah.
it's very interesting. And then you went through before I want to go through the laundry list of things that you said that help reduce anxiety because
Mhm.
some of those maybe are obvious, but others like having a pet in the office is a little bit less obvious. So could you go through each one of those a little bit in detail?
That's true. So with pets, for example, they have the ability, as long as a person is open to the idea of pets, because some people just don't even like pets at all. But there's a reason why they can actually lower stress hormones and increase the feel-good chemicals of the brain, such as dopamine, just based on how they interact with people. It's unconditional love, it's loyalty, all that kind of stuff. So there are literally VA hospitals around the country who have dogs with people with PTSD. There are
Hmm.
also courthouses, including one in St. Paul, that has either one dog or possibly more now as part of these courthouse canine programs, where people who are afraid to testify on the witness stand will do so with a dog on their lap or a rabbit or something like that. And as they're petting it, their stress hormones are being lowered and they're more apt to testify. It's pretty interesting how they can
Oh,
actually help you. And
well,
that's just pets.
wow. Well, that's interesting. And I know one of the things that you write about is the power of like people having their favorite things in choice.
Yes,
And could you elaborate on that a little bit?
sure. So there's actually this scientific term that's called salient stimulus, meaning that the actual stimulus has some meaning for you. So music, for example, there's a reason why people who have Parkinson's disease are less apt to shake if they're dancing to music that's relevant to them. So it could be an elderly person who's listening to big band era music, like your just kind of your fast moving sort of big band stuff. By listening to that, it could evoke memories for them, such as their first kiss or their brand new car or graduating from high school, things like that. Same thing for people with dementia. They're more apt to be less agitated and be more just kind of like communicative with people if they actually hear music that's relevant to them. And that's because music is lowering those stress hormones. I know for me personally, even though my brain tumor wasn't diagnosed as cancerous, I still had to have radiation treatments because the surgeon chose to take just half of the tumor out and leave the remaining half. It was too dangerous to take out the whole thing.
Hmm.
So the remaining half got the radiation treatments. And one time in particular, when I was at the hospital, I had my list of music that was relevant to me on my smartphone. And thankfully, the radiation team let me play it in their docking station. They had speakers there at the hospital.
Hmm.
So every day for me, it was old school hip hop because that's kind of my vibe. I like a little Salt and Pepper and Run DMC and whatever. So literally, I am laying on the radiation table. I've got my arms at my sides. I have a strap around them. I have a mask on my face, so my head cannot move off this table. And then the radiation tech's job, so to speak, was to turn on my music before going into the observation room.
Hmm.
Well, in the observation room, he could actually view me through a window, and then there was a wall full of computer screens and then a microphone in case he had to give me directions or something. Well, on this particular day, the song of the day was Rapper's Delight by the Sugar Hill Gang, which I think came out like in the late 70s or early 80s or something like that. Starts out kind of disco-y, and then it gets a little bit more upbeat as the guys start rapping over it. So I'm laying there like this.
I was gonna say, like, how do you stay totally still during
Right.
Rapper's Delight,
So,
right?
so I'm laying there, but on the inside, I'm dancing.
Oh yeah.
So as I'm laying there, the tech turns on the song, goes into the observation room, and over the microphone says, "And today we have a little radiation for the ladies." He literally used the music, laughter, and act of kindness, all these things to lower my stress hormones. It's almost as though I forgot where I was. It was kind of like I was at a club and radiation was on the house, for
Yeah.
everybody. And it was an amazing thing. And for him as the caregiver, it put a spring in his step as well, because by making me happy and by the music and the laughter and the kindness helping him feel good as well, it made his day too.
Yeah. I mean, we're communal creatures, and so
Yeah.
as empathetic creatures, we absorb each other's stress and actually absorb the sort of the whatever defuses stress, right?
Yes.
And
Yes.
and that's in a dental practice, because obviously the people listening to this are, are typically related to dental practice. So,
Yes.
and there's probably not a shock to anybody that there's stress that
Oh yeah.
comes in a dental practice.
Oh yeah.
So, any recommendations that you have specifically for dental teams?
Good question. So, first of all, if you can actually help the patient feel comfortable and have good soft skills, build rapport with them, maybe even make them laugh, perhaps even address the elephant in the room, maybe like say to the person, okay, scale of 1 to 10, how cool is it to be right here, right now, or whatever. If you and the patient's going to be like, not so much, but laughing or whatever, and you can kind of read that person and see how much you can joke around with them. But by having good soft skills and building that rapport and trust with the patient, that's going to help you as well and help your experience overall too with the dental practice.
Mhm.
Also, I know that some dental practices, including when I had you as a dentist, would allow people to actually have music on their smartphones and
Mhm.
listen to that as part of their practice or during their appointment. And if that client, or excuse me, that patient could be more relaxed listening to their favorite music, not just favorite type of music, but favorite songs, their experience is being enhanced. Then they might be less combative with the person who's there working from the dental team. Perhaps they'll be less apt to project their insecurities about being in the dental chair onto you.
Mhm.
And by having that positive experience, the benefits go beyond the chair because that patient will be less fearful about the next appointment. And maybe they're the ones the next time joking around with you as opposed to you joking around with them. Another thing that comes to mind is something that's called compassion fatigue and trying to acknowledge that with dental care staff. Compassion fatigue is something where the person just after a while just kind of just feels worn down, especially during the actual pandemic and
Mhm.
just the new fears with the job and how you kind of address those things and by acknowledging that the caregivers, meaning the dental team, that their needs and wants are important as well, not just the underlying patients. It's win-win. Another thing that comes to mind for caregivers is what's called emotional labor. And emotional labor is something where maybe the dentist or the hygienist or somebody is all smiles with the client or the patient. Hey, how's your day going? Great. And on the inside, you're thinking, yeah, mine's not so great, but you can't express that out
Hmm.
loud. So there's that dichotomy between how you're actually feeling versus how you can express it on the outside. And again, by addressing those things with the dental care teams, whether it's through team meetings or team happy hours, or perhaps just even asking someone, "Hey, how's your day going? I appreciate what you're doing." It validates how they're feeling and what they're experiencing, and builds morale all around.
Yeah, I think a lot of dental practices have this sort of popularized by Disney, the sort of like front stage, backstage, where there's the break room and stuff.
Yeah,
But when you go to the office, you're smiles and happy. But I haven't heard anybody really reference the sort of stress that comes with that sort of putting on the happy face kind of thing, right?
yeah,
Which builds up over time. And a lot of this, I think, kind of like either escalates or de-escalates, and you can you can choose to be the escalator or the
right,
de-escalator, right?
right. There's also something called emotional injury, or excuse me, moral injury. And that's something where, as a dental care provider, you might think, wow, this patient could really use a crown, or this person could really use a bridge, something that's very expensive, but the person can't do it because they can't afford it. And so then you're having to have the heavy heart of, wow, you know what? I wish I could help this person, but it's just not, it's not going to happen, or maybe it's going to be delayed or whatever. And so again, there's that dichotomy of knowing what you feel is best for that person and actually being able to fulfill it. And it could also be a scenario where maybe the patient in question is a little kid, and you think that they should have something done with their teeth, and maybe their parents are like, "Oh no, he'll be fine." Well, no. So you're,
It's a big deal
yeah,
that you're talking about. And
yeah,
I think we typically talk about it like diagnosing the patient's wallet, like people having dental teams, dentists, just getting sick of being rejected,
yeah,
right? But it's actually more than that. You're right. It's more substantial because you know what's in this person's best interest, at least from your perspective.
yeah,
And if they don't see it from that way from their perspective, it can't. And you frankly know they're wrong, right? I mean, like
yeah.
that's taxing with time. I always think of it too that as somebody that's delivering healthcare to a patient, that there's where there's anxiety, we also sort of separate ourselves from that anxiety in the interest of performing at a high level. Because if you're completely stressed, you're not going to be able to work in
Yes,
nanometers like dentists do,
yes,
right?
yes. It got a little bit kind of detached, I would think, as far as like getting the job done. If the emotions totally envelop you every time, you're going to get lost and drowned in your job. So I understand that there is a somewhat of a sense of stoicism with different things, but we're all human. So I
Hmm.
can see why, even if little things pop up here and there that create stress for a dental care team, from a cumulative perspective, they're going to add up. And even something as simple as just thanking people. Just, I mean, I know when I had my cleaning a few weeks ago, I had said to my hygienist, I jokingly said, "Thank you for the opportunity to be here and be afraid of you." You know,
That's
and she goes, "Well, no problem." And the reason why I said that is because it's my understanding that, especially now during the pandemic and the aftermath, that a lot of dental practices are short staffed. And
hmm
I thought, for her to be there and know that there are certain risks involved, it's a privilege for me to actually get the ability to be afraid to be there.
wow. Well, and
Because
you're doing the work though that really has to be, in my mind, it should be done by the people who are overseeing the team members, right?
Yes,
Obviously, over you can't over appreciate people,
I agree.
period, right?
I agree.
And I that's very interesting. And one thing you touched on is that I've really recently been working on myself is that when somebody says thank you, instead of saying no problem, saying you're welcome. Because if
Mm,
you say no problem, it's almost discounting
right.
the gratitude that somebody just passed your way too,
Yeah.
right? I think
Yeah.
that was, I don't know, I just decided to throw that in there, which
No,
isn't really apropos.
no. But it's like, take the compliments, not just the hits.
Yeah.
When someone is projecting something onto you, and on top of that, I think that somebody could read some kind of a manual like from the dental care school or that kind of thing, and learn facts. But wisdom comes with experience, and
Mhm.
if you have more seasoned people on a team, it's almost like mentoring for the newer staff. And saying, hey, you know what, acknowledging that you might be feeling some compassion fatigue right now, or some moral injury or emotional labor that I mentioned, and acknowledging it and saying, hey, you know what, you're not alone. And then that person at least thinks, okay, I'm not going crazy.
Wow. So I mean, you lecture all the time now since this
A
book
lot,
came
yeah.
out. No, I mean, and you're talking with people. What's the feedback you're getting from people who have anxiety, and have they been able to help their caregivers to sort of have a better environment for them?
Yes, absolutely. One of my speeches that I give to people purposely centers around caregiving. It's called Unsung Heroes.
Hmm.
And it could be any industry. It could also be in a parental setting as well. People don't also realize that with caregivers, it could be the child taking care of the parent.
Hmm.
It could be one spouse taking care of another. It could be a sandwich generation where it's someone taking care of their kids and their parents. So caregiving takes on multiple different roles, and they're not always recognized. And I know that when I was talking to a friend of mine about how I write out those thank you notes for my nurse practitioner, and he looked kind of puzzled. And he said, "Well, Jen, no offense, but isn't that just kind of her job?" And I looked at him and I said, "Well, okay, yes, it is her job. However, do you give your mom or your dad a card on Mother's Day or Father's Day?" And he's like, "Well, yeah." And I said, "Well, isn't parenting kind of their job, so to speak?" Which I said loosely as a very loose analogy. And I
Yeah.
said, "But I hope you see value in saying thank you to them." And he's like, "Oh, yeah, good point." Well, the same thing is based on professions, not just what people do in the home. And so, as I've tried to spread this message, it is having an impact. I'll get emails from people and text messages,
That's great.
um, phone calls, stuff like that, saying, "Yeah, I tried what you suggested and it's making a difference."
I want to bring it back to dentistry because,
Yes.
right. And
Yeah.
one of the things that you talk about is the sort of variability between patients. And I'm going to mix two concepts together: the variability between patients and their sort of sensitivity, and also the fact that I like to think of adults as just like big kids that don't that try to are trying to hide the fact that they're big kids, right? And so people don't show up like you will say thank you for allowing me to be
Afraid of
scared,
you.
afraid here today. But how many, there's just not their patients don't just show up and tell you, hey,
Yeah.
guess what? I'm afraid. And if they do, they're probably minimizing it. And I guess what I'm asking is when you walk into an operatory, you don't really know the anxiety that's sitting in the chair, right?
Exactly, exactly. So that's why I'll suggest to people it could be helpful if you ask the patients, "Hey, you know what? Just as part of our practice, because that way it's not personal, like you're singling the person out. As part of our practice, we always ask people, like, what's your comfort level today?
Hmm.
Would you prefer both the nitrous oxide and the Novocaine or whatever? I mean, something where you're acknowledging that it's not just you picking out that person, because that person might think, well, I don't want to show any kind of weakness if nobody else is. Well, no, maybe it's that you ask everybody. Hey, as part of our practice, we ask, how are you doing? Do you want XYZ, whatever the amenities are at that particular practice? And just kind of acknowledging it that way. That way it's not personal, but you're still acknowledging the potential elephant in the room. Another way is, as I mentioned earlier, through laughter, just saying something like, okay, I know that most people don't want to be here, haha, so it's like, where do you fall on that scale? Like how much do you not like it or whatever? And if you can start kind of building rapport with the person and maybe putting some humor in the mix, again, depending on what that person's demeanor is like,
Hmm.
that can make a difference too in how you approach them and trying to ferret out, okay, well, is this person really okay with what's going on? Or should I try to go the extra mile and do something different? I know what you did in the past that really helped me when you were doing my teeth was as you be doing a crown for me or filling or something, you might ask me as we were going along, "Hey, Jen, or how are you doing? Are you okay?" And I would kind of like lift my hand, say this or this, or
Yeah.
whatever. But it wasn't just at the beginning of the appointment, it was throughout the procedure. How are you doing? And I would go like that. So acknowledging that along the way, maybe I changed my mind and I'm not doing so well and I could use a cold washcloth on my forehead or whatever.
Yeah, I actually had several patients basically just say, stop asking me questions,
Oh,
right?
not me.
No, but I don't think that's a bad thing, right? I would rather err on the side of that than just not checking in with people. And I
Oh
think
yeah,
that's a great point. And I think that it's just some of this sounds sensical, but it's just not happening. Right? Do you agree with that?
yes,
I mean, it's
yes,
a sort of an epidemic of this. I call it the great disconnect between healthcare professionals and patients. And I think that what you're kind of saying is that like this is something that has to be acknowledged from both sides, and
absolutely.
that's really kind of the key to reducing the anxiety, which is kind of rampant in dentistry.
Oh
Right?
yeah. Well, and I also want to just stress, as I alluded to, that by trying to enhance that experience of the patient, there's a greater opportunity for the caregiver then to have a better day because that
Hmm.
person's not going to be projecting onto them, and that person's not going to be passing out like I have for for years in the dental chair,
Well,
and also know too that there are certain things that again you can't always see that could be playing a role. So you may be doing everything right. Maybe you have asked me how are you doing in the chair, and things seem to be fine. But like people like me, I have what's called an overactive vasovagal response,
hmm
meaning that it's some kind of a nerve, I think, or something, where all of a sudden my blood pressure drops and my heart rate increases. My ears begin to ring, and before you know it, I'm out. And that had nothing to do with, your demeanor. It was
Hmm.
just me. I know that years ago I was at a dermatology appointment where my dermatologist was taking out like a little cyst on my arm, and he knew that I had a history of passing out on his table. So he has this nurse on one side of me, he's on this side, and as he's digging around in my arm, I said, "You guys are about to lose me." And so,
Oh,
like, I could tell my skin was getting clammy and about to pass out. So he says to his nurse, "Okay, Felicia, ask Jennifer a question." So she goes, "Jennifer, what's 12 times 5?" And then he goes, "No, ask her a question she knows." Well, then the laughter, literally, the color came back in my face.
oh, wow.
My ears stopped ringing. The clammy nature of my skin went away because laughter can also lower those stress hormones. And then a little bit later, when he was digging around doing the actual stitches,
Yep.
I said, "How's it going over there?" And he goes, "Well, I'm not going to win a quilting bee anytime soon, but I think it's fine." Well, again, the laughter made the color come back to my face, and they literally the nurse told me later she could actually see physically how the laughter affected me.
Oh, wow.
Yeah,
That's really interesting. I mean,
yeah.
you have so many great stories, and such a great perspective. How can the audience find more, learn more?
So thanks for asking. So I am on Facebook now, finally. So just under Jennifer
just
Fernjack.
just in time for it to
Yeah.
be like,
What a coincidence.
yeah,
Yeah.
exactly.
Yeah. So on Facebook, there's
Yeah.
Jennifer Fernjack. I also have a website that's jenniferfernjack.com. And on my website, it has links to like Target's website and Barnes and Noble and Walmart where you can actually buy my book.
Oh,
So
awesome.
it's pretty amazing stories that are in there.
Yeah, well, thank you, and it's a great book. Like I said, I love it. I urge everybody to pick it up. It's called Greater Than. This is what it looks like by Jennifer Fernjack. So go to jenniferfernjack.com. And Jennifer, thank you so much for being on the podcast.
Thanks for having me.